I am going to be reviewing the human heart model that we have normally in our A&P2 lab. And this will help you learn the parts of the heart. It'll also help you prepare for your midterm lab practical. Um, on the midterm practical, you will have the cardiovascular system. So it'll be parts of the heart, blood vessels. You also have respiratory system and the digestive system as well. So this is the heart model, and you're looking at a view of the inside of the heart. This has been cut into a frontal section, and the front part of the heart has been removed so that you can see into the inside. Here you can see the 4 chambers of the heart. The 2 atria are here. These are the 2 superior chambers of the heart. The right atrium is on this side. The left atrium is on this side. So this is the right side of the heart. This is the left side. So right atrium, and then below that is the right ventricle. And then here's the left atrium and the left ventricle. The 2 valves that are in between the atria and the ventricles are called cuspid valves. Sometimes they're called atrioventricular valves, but typically I use the cuspid term. The one on the right side is called the tricuspid valve because it consists of 3 flaps of tissue rather than just 2, which you have on this one. This is called the bicuspid valve. Bi means 2. There's 2 valves on that, or 2 flaps on that one. This one also has another name. It's sometimes referred to as the mitral valve. So that is on the left side of the heart. Tricuspid is on the right side. You may also notice that there are sort of string-looking things that are connected to the cuspid valves. These are called chordae tendineae. They attach from the valve down to muscles that are in the ventricular wall. These muscles are called papillary muscles. And these chordae tendineae prevent the valve from turning inside out or from opening inside out. So this valve right now, as you see it, is closed. It can only open down. So the flaps that form the valve, this is sort of what they look like when they're closed. And when they open, they go like this. And then they can close again. They will never open up, or should never open up, this way. So the chordae tendineae maintain enough tension on the valve, so they're pulling on the valve so that it cannot open up this way. If that were to happen, it would allow blood to travel in the wrong direction, and then blood wouldn't get where it needs to go. It either wouldn't get to the lungs to pick up oxygen, or it wouldn't be pumped throughout the body. Either way, it's not a good thing. So these chordae tendineae keep enough tension on this valve so that it can never open the wrong way. It can't ever open up. It can only open down. So blood is always going to flow from the atrium down this way into the ventricle. It's never going to go up because the valve should never open that way. So that's the important role that the chordae tendineae have. And you have them on both sides, the right side and the left side of the heart. You can also see these ridges in the ventricular wall. They're called trabeculae carneae. They are just that. They're just ridges caused by raised bundles of cardiac muscle fibers in the heart wall. All right, here, dividing the heart into 2 sides, right and left, that is the septum. The portion of it that's in between the 2 atria, that's called the interatrial septum. And the portion down here in between the 2 ventricles, this is called the interventricular septum. You can see the heart wall, which goes all the way around the outside of the heart. Can't really see the distinct separation between the 3 layers of tissue that form the heart wall. But the main, like the thickest part of the heart wall is the middle layer of tissue, which is called the myocardium. So that's mainly what you're seeing here, and then up into this side as well. So another thing are some of the blood vessels that are associated with the heart that you can see on here. This is the superior vena cava, carrying deoxygenated blood into the right atrium. Then coming up from below is the inferior vena cava. So that's bringing deoxygenated blood up from below the heart and bringing it back into the right atrium. Right here, this is the aorta. So this is coming out of the left ventricle. And so this is called the ascending aorta, and then it curves around. That's called the arch of aorta. This is called the brachiocephalic artery or brachiocephalic trunk. That goes toward the right side of the body. And then these other two arteries go to the left side of the body. This is the left common carotid artery, and this is the left subclavian artery. Then if I turn this around and you're looking at blood vessels that are, these are blood vessels that are actually carrying blood into and out of the heart wall itself. And any of the red ones that you see, these are called coronary arteries. The blue ones are called coronary veins. And the really big blue one right here is called the coronary sinus. Okay, one last thing on here, and then I'm going to show you the other side of the heart model. There are, so we talked about the two cuspid valves. There's another set of valves which are called semilunar valves. There is one at the entrance to the aorta, which you can see right here. This is called the aortic semilunar valve. And you can see the other one on the other half of the heart. So this is the front half of the heart. Take that off, put this piece aside. Now you're looking into the front half of the heart. This right here is the pulmonary trunk. So this comes out of the right ventricle, pulmonary trunk. So at the entrance to the pulmonary trunk is the pulmonary semilunar valve. You can see it if you look into there. All right, and that is it for my review of the heart model.